thing, because I travel the country and I speak about mental health and first responders, one thing that I really drive home is it's called the ACE test, and it's the Adverse Childhood Experience Study. In a very short Cliff Note version, what it is the doctors from Kaiser Permanente and the CDC were finding that so many young children were having these chronic illnesses and they couldn't figure it out. So they did a study of 17,500 participants, and they found that there's 10 questions, and you answer questions about your childhood. It's not like I got a B on a test or I failed a basketball game, but it's, did I have a parent with mental health, divorce, separation, incarceration, being addicted to alcohol or pills, sexual abuse, emotional abuse. There's 10 questions, yes or no. So those who answered 4 or more had a 12% higher risk of committing suicide, had ischemic heart disease is the #1 killer in the United States, and you have a 1 in 4 chance of being diagnosed with that. And these are just things that happen to us as adolescents. So I believe if we can be proactive to understanding where we came from, you can actually set yourself up to have better mental health just by knowing where you came from as a child. And I think that's so important because we always want to say, well, nothing really happened to me. I just woke up with anxiety, or I don't feel right. But people say, well, what happened? So sometimes we don't have an answer to that. And if you can understand where you came from, maybe 10 years ago, now you can understand why you're being impacted now.
Yeah, that's so true. That's really good. I know, like, analyzing what's happened. There's a few people, like I know Jordan Peterson has this thing where it's like a self-authoring, which I know a lot of people talk about. I haven't done that. But, you know, I want to know, what are some misconceptions when it comes to mental health?